Hi, I am Dr. Batra. Today we'll talk about Achilles tendonitis. I have a model of the foot with me. So if you can appreciate this tendon in the back of the foot, this tendon is called the Achilles tendon, and this is responsible for the plantar flexion, that is the downward movement of the foot. So when there is inflammation of the junction of this tendon to the bone, that is the time when pain develops in this area, which is classically more in the morning, and you just feel discomfort. You might even feel like limping because of it. So this is called Achilles tendonitis. I'll go through the notes. So what is Achilles tendonitis? It is inflammation of the Achilles tendon insertion area, or it can be slightly above the insertional area. So there can be insertional Achilles tendonitis, or it can be just slightly more proximal to the Achilles tendon insertion area. Now, what it actually is a overuse injury causing inflammation of the Achilles tendon. It is more common in runners, jumpers, and weekend athletes. Weekend athletes mean those who don't play all week and suddenly on Sundays or the weekends they feel like they are athletes and unnecessarily exert. In fact, this weekend warriors, like we call them, even lead to this Achilles tendon rupturing. So yes, okay. What are the symptoms? There is posterior heel pain in the back of the heel, especially with activity, morning stiffness or pain on the first few steps, and you can even feel a thickening or a nodule in this area. Uh, the patient himself can feel that a lot of times. How do we diagnose it? So, clinical symptoms are the most obvious symptoms for the diagnosis. We palpate where the tendon is inserting in the bone, and it's almost always very painful. And we might advise x-rays to check if there is any bone growing out. That's called a spur, and that helps us find out whether conservative treatment will be effective, and it will tell us the long-term prognosis as well. Now, ultrasound can be advised if we are thinking there's a partial tear in that tendon or not, as well as the degree of inflammation. Ultrasound will show the thickening of the tendon. If we are thinking about possible surgical intervention, we might even advise an MRI for this before we go in for the definitive treatment. What are the treatment options for this problem? What can you do first of all? So, slight heel elevation tends to relax this tendon. So, slightly elevating the heel part, maybe with heel insoles or special shoes, can help. There is a lot of exercises. Now, what happens sometimes when the calf muscles are tight, that can put unnecessary stress on this, and that also causes it. So, eccentric calf strengthening has a 60 to 80% success rate. Activity modification, anti-inflammatory medications all help. In physiotherapy, there is shockwave therapy, which has a 65 to 75% success in chronic cases. If simple treatment doesn't work, we have the option of giving injection in that area. Steroid injections are not recommended because there is a risk the tendon can rupture. What is recommended is something called PRP injections. You can search it online. They have shown promising results. If nothing works, last option we will advise is surgery. It is advised after we try at least 6 months of conservative treatment. In surgery, what we do is we open up that part, we remove the tendon which is degenerative, and then if we feel the tendon needs to be repaired, it has become, the insertion has become weak and it needs to be reattached, then we do that as well. So, when do you see a doctor? If you've not improved at all with slight heel elevation with anti-inflammatory medicines, or if the pain has lasted for more than a week or 10 days, please see a doctor. Any questions you can mention in the comments, and that's it. Thank you. Stop recording.